So I vote in the affirmative.
Ms. Rosenthal in the affirmative. Ms. Harris to explain her vote.
You know, I have the privilege of being in the mecca of entertainment, living in Coney Island and representing a district that has the best amusement area, better than the other one. I won't name names, Six Flags. So for us, entertainment is important. And right now, the only way we have a great economy is Airbnb. Because we do not no longer have the Surf Hotel, which is now is gone, and the other hotels that we used to have in my district, my residents that live in my area, my constituents, have now been able to turn their beautiful homes into a place of economic development. So for me, although I respect the sponsor greatly, and I respect, of course, all of you, this bill for me, I have to unfortunately or fortunately for my district vote in the negative. I have to make sure that my district thrives, and the only way they can thrive is through this great way, is through Airbnb. So I vote in the negative.
Ms. Harris in the negative. Mr. Mosley to explain his vote.
Mr. Speaker, I want to applaud the sponsor of this bill, and I also want to applaud Assemblyman DeLon for giving us a technical breakdown as to how this bill will be applied. But in New York City, since 2000, we have lost over 400,000 units of apartments that are renting for $1,000 or less. 56% of all New York City residents spend more than a third of their household monthly income on rent, while 30% are spending more than half of their income on rent. Couple that with the more than 58,000 men, women, and children who are living in our shelters, men and women who are doubling up and tripling up, and then we're not even talking about those who are just undocumented homelessness who are living on our streets. This issue is pervasive throughout New York City. And although I applaud the e-commerce industry, and I think that is an evolving industry, but that doesn't mean that they should be that they should be allowed to avoid regulations, rules, and procedures. I applaud our sponsor on this bill because I know she's a champion for affordable housing, but more importantly, she's a champion for doing what's right for the city of New York and the residents who live in it each and every day, looking to survive, looking to just provide the bare necessities of putting a roof over their family's head. So I applaud you, and I vote in the affirmative. Thank you, Mr. Speaker.
Mr. Mosley in the affirmative. Ms. Simon to explain her vote.
Thank you, Mr. Speaker. This is a bill about which I have great internal conflicts. My district is one in which there are many brownstone owners who are using Airbnb for a unit in their home. The vast majority of people who have written to me and are concerned about this probably are not covered by this because they do not own a Class A multiple dwelling, but many others do. So this is a particularly difficult vote for me. However, I am very aware that the law already prohibits this. This particular bill goes to the advertising issue, and I will be voting for the bill. Thank you.
Ms. Simon in the affirmative. Mr. Zabrowski to explain his vote.
Thank you, Mr. Speaker. To explain my vote, I've sat and listened intently to this debate, and I'm a bit torn. Certainly want to help out what seems to be an issue in the city of New York, and I'm inclined to vote in the affirmative. I just want to point out that a bit of irony that as we take up this bill, the Senate takes up a ride-sharing bill over in the other House. And I think it's incumbent upon us to look at the issues and the challenges of all of our districts. And so I'll be voting in the affirmative to assist my colleagues in dealing with this issue. And as we sit here today and we have several hours left, I would ask that we come together and try to deal with another issue in the rest of our districts, which is the lack of affordable and reliable taxi and other service, and come together and find a compromise so that we can allow ride sharing and solve that program in the rest of our districts in upstate New York. Thank you, Mr. Speaker.
Mr. Zabrowski in the affirmative. Mr. Goldfeder to explain his vote.
For sponsoring this bill. I think it is a great bill, and I think it's a great bill for all the reasons that she explained during the debate. And I think that there's a real problem here in areas of Brooklyn and areas of Manhattan where people are taking advantage of this program and are really bringing down the quality of life in certain buildings. However, as my colleague Ms. Harris pointed out, in areas, beach communities like Rockaway, in areas around Jamaica Bay, in Howard Beach and in Broad Channel, we want people to come in. Last year, we had a record of 7 million people coming to visit our beaches, and instead of being able to stay in the neighborhood because we don't have those hotels, we don't have those accommodations, people clog our streets with their cars, and they literally destroy our quality of life. Having places where people can have an affordable place to come visit the beach for a day, for 2 days, for 3 days, to enjoy the amazing economic development and advancements we have made since Hurricane Sandy, that would be a huge, huge benefit. And while, again, I understand the concerns and think that those concerns need to be addressed, unfortunately, I'm going to have to vote in the negative.
Mr. Goldfeder in the negative. Mr. Skoufis to explain his vote.
Thank you, Mr. Speaker. I've been a no as this roll call has progressed, but I'm going to change my vote in light of what my colleague next to me has said. I do have concerns. I think we ought to be doing our best to try and make these 21st century technologies work rather than do what we can to prohibit them into folding into our society. But I do respect that this is an issue in New York City as a non-New York City member. And I want to reiterate what my colleague said, and that is that I hope that our New York City members will respect that the Uber issue is very important to us outside of New York City, where we have such limited transportation, particularly in the evening hours, particularly if you are a young adult going out in the evening. So I will be changing my vote to a yes out of respect for my New York City members who very strongly do support this bill. I hope as we enter the final hours here, we're able to continue the Uber discussion for those of us outside of New York City. Thank you, Mr. Speaker.
Mr. Skoufis in the affirmative. Mr. Titone to explain his vote.
Thank you, Mr. Speaker. I hadn't intended to speak on this, but having heard from so many from the so-called outer boroughs, I wanted to give my perspective as a Staten Islander from the outer boroughs of Manhattan. I'm voting yes on this because, number one, well, in my district, we do have gentrification going on. We have economic development. We have the world's largest wheel coming. We have the city's very first outlet centers coming, 2 hotels, and the theaters being built right now. So, I hear about wanting to attract tourism, which is great, but I don't think you attract tourism by creating an atmosphere where the residents who have been there are suddenly put in a very precarious or even volatile or dangerous situations, as my colleague from the West Village described. So I'm voting yes because I see this as an opportunity for me to start preparing for a whole lot of tourists coming to my district, and they are perfectly welcome, but there has to be the balance between the bedroom communities of Staten Island as well as the tourist industry. So I think it would be a mistake to vote no simply citing you want to promote tourism in your district. You're not doing that. Tourism comes not from the availability of transient populations, but rather by something to see, to do, and maybe shop and eat. So I commend the sponsor, and I'll be voting yes, or I already have voted yes. Thank you, Mr. Speaker.
Mr. Tatone in the affirmative. Mr. Otis to explain his vote.
Thank you, Mr. Speaker. There's been lots of talk here today about the new economy and new kinds of services. And the challenge for us in New York is that we need to balance and merge two different concepts. We cannot throw out public safety, public health, local zoning, insurance issues on some of the matters that come up. And the challenge for us is really not to say it's one or the other, but the challenge is for us is for New York to lead and find ways to protect the public, protect the residents of the people in New York, protect the people that are using these services, and at the same time find ways to welcome them in. I think that in all these areas we will be ahead of the game, and I'm hopeful we are. I am supporting this bill because clearly people should not be able to advertise for services, in this case, that they're not really legally able to provide, so that seems like a pretty obvious conclusion. But I think we have to make sure that we're ahead of the curve and not behind it, and I'm optimistic that we'll be able to. Thank you, Mr. Speaker. I vote aye.
Mr. Otis in the affirmative. Ms. Walker to explain her vote.
Thank you, Mr. Speaker. One of the things that I'm concerned about as it relates to what happens in communities like I represent is we fight so hard to make sure that multiple unit dwellings are readily available to people who are living in our homeless shelters. We know that we don't have enough affordable housing to house all of the individuals who are in need of a place to live and raise their families. And then there are these people who have this opportunity, and instead of utilizing it, they take advantage of it and they advertise it to make money off of it. I think it's unfair to each and every one of us how we stand steadfast to make sure that we have the proper rent laws in our state to ensure that everyone has a place to live that they can afford. I think it's a slap in the face of all of the advocates who work tirelessly to ensure that multiple unit dwellings are available to people who need them the most. And for people who utilize this opportunity to take advantage of it for their own economic gain should be shamed. And I think that this is an excellent opportunity to put them on blast, if you will, to say that what you've been doing is wrong and it won't be tolerated here in this state. So I am proud to vote in the affirmative. Thank you.
Ms. Walker in the affirmative. Mr. Montesano to explain his vote.
Thank you, Mr. Speaker. I wasn't planning on addressing the vote, but listening to everything going on, it's an excellent piece of legislation. In Nassau County, every village and the cities, the two cities that we have, all have legislation that prohibits this type of activity. If you have an illegal apartment or you're violating the building codes for rentals, you cannot advertise. And the law out in Long Island says that if you even advertise the rental, that's a presumption against you in court for prosecution. That's how strong they are about it. It's the same thing here in the city of New York. The building code does not permit this type of activity, so why would we allow the illegal activity to be advertised? It's just common sense. So for these people that vote against the bill, what you're saying is not only is the illegal activity permitted, but you can advertise your illegal activity. So it's just, the bill is common sense, and I applaud the sponsor for it. And I'm voting in the affirmative. Thank you.
Mr. Montesano in the affirmative. Are there any other votes? Announce the results.
Ayes 96, noes 20.
The bill is passed. Mr. Morelli.
Thank you, Mr. Speaker. I'd now like to take up the three bills which comprise our heroin opioid abuse package led by Ms. Rosenthal. We're going to start with her bill, Rules Report 487 on page 18 of the main calendar. Then we're going to take up Mr. Cusick's Rules Report 486 on page 17, and we'll conclude this package with Rules Report 485 on page 17 by Mr. Steck.
Clerk will read.
Assembly 10,727, Rules Report 487, Committee on Rules, an act to amend the public health law.
On a motion by Ms. Rosenthal, the Senate bill is before the House. The Senate bill is advanced. An explanation has been requested.
Okay. The purpose of this bill is to require continuing medical education on pain management by physicians and other healthcare providers, to mandate insurance coverage for needed inpatient treatment services, to limit opioid prescriptions from 30-day supplies to 7-day supplies, and to require pharmacists to provide additional education and counseling to those receiving opioids.
Mr. Graff.
Will the sponsor yield?
Will the sponsor yield?
Yes.
Sponsor yields.
Thank you, Linda. Part B of this. Now, it requires the health insurance policies to provide unlimited inpatient coverage for medically necessary treatment of substance abuse, correct?
It's already unlimited. Insurers already have to pay for that.
All right. Do we do anything to stop the requirement that insurance companies are giving people that you have to fail 3 times outpatient in order to go inpatient?
In 2014, we eliminated the fail first requirement.
Okay. Well, it's my understanding they're still doing that.
Well, they should be reported.
All right. Now, we also have they can prescribe, do we require doctors to counsel their patients about opioid addictions in this? Bill?
In inpatient,
Okay. And now when they're prescribing opiates, do we require doctors to give them a non-opiate alternative when prescribing?
no, we do not.
Okay. All right, now we get to Part D.
Let me just expand on that. The purpose of the part of the bill that requires physician education will hopefully lead, and is intended to lead, to physicians not relying exclusively on mega doses of opioids. So hopefully they will learn to use other modalities in treating people with substance use disorders.
Okay. Now in Part D, where we give instructions to pharmacists, bill requires pharmacists to distribute different materials pertaining to opioid abuse?
Yes. You know, pharmacists play a critical role in educating consumers about prescription pain medications. And pharmacists, and I've spoken to many of them who are very happy that they will play a part in educating consumers about the risk of addiction and available treatment resources.
Terrific. Now, one of the problems that we came across, and a lot of times out on the island, we do things where we take in old medication so people can drop it off. So there'll be a big event saying, bring your prescriptions here, your old prescriptions. We'll collect them. Okay? And that's been a big problem with especially teenagers, because they raid their drug cabinets and stuff in the bathrooms. And they're having pill parties and all this other stuff. And they're infrequent when we turn around and have these events. And the other thing that they do is you could drop it off at the police station or the jail.
Right.
And it's an inconvenience for people and a lot of people don't like to come in with a bunch of drugs in a bag to a police station or to go to a jail to drop them off. Do we do anything in here to entice pharmacists to have a receptacle to collect used prescriptions that are no longer needed?
In this bill, it mandates that procedures for safe disposal of unused controlled substances be explained to people receiving these prescriptions. In addition, the pharmacy can provide information regarding safe disposal, and the pharmacy can also go further. I think this is an idea whose implementation will be coming shortly.
Well, you would agree that, this would make it more convenient to people, their local pharmacists were to collect this.
Absolutely, and the use of leftover pills is what gets many people addicted to opioids. So I'm sure pharmacists are very happy to participate in prevention and education.
Okay. Thank you, Lynn. On the bill?
On the bill, sir.
Now, we have 3 bills that we're going to be talking about right now, and I will be supporting the legislation. It's a great first step in dealing with this problem. Unfortunately, it is only a mere baby step. Though we address a lot of issues, there are a lot of issues yet to address if we're going to take a hold of the problem. This has become a problem not only in the state of New York, but it's states around the country, to the point where it's even an international problem. So what I'm going to try to do, point out as we go through the different pieces of legislation, is where we've fallen short. And the purpose of this is to get other people to look at what we're pointing out. We went out and did forums, and we did a report on this side of the aisle on heroin. And we listened to people, and we listened to the problems throughout the state. And though we've addressed some problems, we haven't addressed the lion's share of the problems. So what I'm trying to do here is point out the holes that we need to fill. And I appreciate the opportunity to do so on the floor. Thank you.
Thank you, sir. Mr. Saladino,
Would the speaker yield for a few questions, please?
the sponsor will yield.
The sponsor, rather.
Yes.
Thank you. This legislation is so important. We've been calling for legislation of this type and like the other ones that are proposed that we'll be voting on today for quite some time. Can you tell me if some of your legislation looked at the proposals that were presented by Senator Gillibrand, where she spoke to the issue of creating guidelines or having the CDC create guidelines so prescribers could understand the number of pills that should be associated with certain treatments so that prescribers would have a better idea of how to control the connection between pain and that pain management?
Well, actually, I'm very pleased that Senator Gillibrand did discuss this. As you may know, I've had a bill on physician education for quite a few years. It is something that the community of advocates agrees is a very necessary component in helping to stem the opioid addiction epidemic, which is affecting the entire state. Physicians heal, but if they do not prescribe properly, they can cause severe problems, including death. So I am so happy that the provision in this bill would require physicians and other individuals who are authorized to prescribe opioids by the DEA will have to complete a mandatory 3 hours of coursework on pain management, palliative care, and addiction every 3 years.
Will that be available online?
Yes, it will.
Good. That's something they've told us in our meetings and our and in our task forces as we listened to their issues that, we've made it tougher and tougher for them to continue to survive at the same level. And very, very important. And that would apply to not only to MDs, but DOs and to PAs and nurse practitioners.
Any physician who has a DEA registration will be required to take that. Obviously, doctors who do not have the permission to prescribe opioids by virtue of not having this DEA license will not have to take this.
And when it comes to getting someone into treatment, can you tell us how this will make it easier to get those folks, those addicts, into treatment, and so that they'd be able to have less hurdles in their way and perhaps would provide for more patients to get into treatment and get the specific types of treatment that will actually break their addiction, and so that we'd have more successes?
Well, one key provision of this bill is that patients will get 14-day without prior approval, 14-day inpatient stay before utilization review kicks in.
Great. Thank you very much. On the bill, Mr. Speaker.
On the bill, Mr. Saladino.
Real important, and I'm proud to be here voting on and voting for not only this piece of legislation, but a number of pieces of legislation that are coming forth out of negotiations. We certainly wish this had come a lot sooner, and the public had called for this quite some time ago, in fact, years ago, but here we are today on an overtime on session, if you will, and getting to these things. So I thank all involved in this, and frankly, much of this has come from the work of the many task forces that have been at work. The previous member spoke about a very important task force that the Assembly minority put forth and got lots of important information. The Senate had some task forces. I, too, put together some people going back 5 years ago, including Dr. Jeff Reynolds, Dr. Christy Golden, Bob Detour, and so many of those folks on Long Island who are the leaders in this field. And one of the things we heard about in describing this as a small step or a first step, it's not actually a first step, because we had many good people, including those in this House, who gave us iStop and then son of iStop, iStop 1 and iStop 2, to curb the amount of pills that were being prescribed and to greatly slow down the doctor shopping. But the experts who I worked with, the doctors who worked with me on some of these investigative studies 5 years ago, spoke to the fact is as you shut down iStop, you increase the need for beds because people go to heroin and whatever else they can get hold of. So it'll be very important going forward to make sure we make the financial commitment in future budgets to properly fend for those residents who now need treatment. And as we increase the number of addicts who need treatment, we need to increase the number of inpatient beds. So I appreciate the legislation. It's a great first step, and I know we have other bills coming by other members that will increase access to treatment, and I look forward to voting for them. Thank you very much, Mr. Speaker.
Read the last section.
This act shall take effect immediately.
Clerk will record the vote. Mr. Godfrey, to explain his vote.
Yes, Mr. Speaker, this is a terrific package. I've helped craft some of the pieces of it. I just want to note that there are states that are doing a lot to help lower their opioid use and opioid overdose deaths by having strong and vibrant medical marijuana laws, which have been very effective at moving people from highly dangerous and highly addictive opioids towards the much safer alternative of medical marijuana. Unfortunately, in this state, our program has been severely limited and hobbled from the start and continuing to this date. And I just hope that as we focus on the opioid problem, that will help us pay more attention to the need to broaden and strengthen our medical marijuana program.
Mr. Rea.
Mr. Speaker, I rise to support this legislation. I'm very proud to represent portions of Suffolk County out on the east end of Long Island. What I'm not proud about is the fact that Suffolk County has the highest number of heroin and opiate deaths in the state. The scourge of this epidemic knows no race, no religion, no socioeconomic background. It affects everybody. And it's my hope that with the passage of this legislation that we will start to make a dent in the number of deaths that occur each year, not only in Suffolk County, but throughout the state. I withdraw my request and vote in the affirmative. Thank you.
Thank you, sir. Mr. Barron.
Thank you, Mr. Speaker. I rise to explain my vote. You know, I'm very concerned about these three sets of bills. First, it is a disgrace and a shame that the governor only applies, even after budget, $25 million toward a serious crisis, an epidemic across this state, $25 million. I'm also overly concerned that now that the drug epidemic has seeped into the white community, it's a public health problem. And we need to find how people, and rightfully so, should get treatment. But when it was in the black and brown community, it was a criminal justice issue. And we needed Rockefeller draconian drug laws to put us in jail for being strung out on crack cocaine or heroin. And I get tired of that now when the white community is impacted by this, now it's a public health issue. And then even in this instance, how many, I've been to some of the hearings, little or no black providers were there to receive any funding to channel some of even this to our community, as though we're not suffering as well from drug addiction. So I have real problems when this happens, and a lot of people don't like to deal with race and think that we bring up racism every time as if it doesn't exist, and as if we pretend we're colorblind, it will go away. Well, I'm going to raise it every time it rears its ugly head. And this is one of those times that now it's an epidemic. And I think it should have been treated like that. And for this governor, we got a $156 billion budget. For it to be treated with $25 million is a disgrace and a shame. I'm going to vote yes for this one because they need to cut down the supply of opioids from 30 days to 7. But for others, I'll be voting no.
Ms. Russell.
Thank you, Mr. Speaker, for allowing me to explain my vote. We have to take very measured and methodical approaches to addressing the problem that we have in our communities with substance abuse, particularly with opiates. It is something that is going to take us a very long time to address. We didn't get to this problem throughout the state overnight, and we certainly need to ensure that we're focusing our resources in communities that are least able to try to address this by themselves. I would like to point out that we can do more than just pass legislation to help our communities try to address this problem. This past weekend, I put together a training for my local physicians so that they would be certified to be able to prescribe Suboxone or buprenorphine, which is a drug that helps people to stay in recovery as an outpatient. I think it's incredibly important that we work to realize the treatment gaps in our communities and work to fill them, those treatment gaps, both with legislation and with practical approaches. and supporting our physician community in becoming educated and being able to essentially open up more treatment slots by simply hosting an 8-hour training program, I think is one of the best ways that we can help. So I would encourage my colleagues not only to support these types of measures where we can impact this issue legislatively and during the budget process as well, but look toward how we can give more tools to our treatment professionals in our communities because I think sometimes we have the best ability to impact what goes on by taking a very practical and grassroots approach to supporting those that we rely on to help our friends and families. With that said, Mr. Speaker, I vote in the affirmative.
Ms. Russell in the affirmative. Mr. Ra.
Thank you, Mr. Speaker. Just briefly on this package of bills, I think this is an example of what can get done when we really want to take the opportunity to bring in experts in a field, and roll up our sleeves, and do the things that might not just be the most expedient and obvious, but really look under the hood at a problem and come up with solutions. So I want to commend everybody that's been involved in this effort on this bill and the others we're going to be voting on. And I am honored to just have the opportunity, like so many here, to support this bill, to cast my vote in the affirmative in memory of so many that we've lost to this problem, and certainly with hope for the future that we're moving forward and going to give people the opportunity to get the treatment they need and hopefully put the brakes on this problem and start to solve it. I cast my vote in the affirmative. Thank you.
Mr. Ra in the affirmative. Mr. Dendecker.
Thank you, Mr. Speaker. I want to thank the sponsor for her commitment to try to make this the best bill she possibly could, and all the people on the task force that worked on it. Where I am very disappointed is I think we lose sight of how we got to where we are. The pharmaceutical companies are making hundreds of millions, almost billions. In fact, I'm sure it's in the billions of dollars off the amount of pain and suffering that we are all affected by now, and they do not get held responsible at all. The DEA, which currently allows these pharmaceutical companies to increase the production because that's who regulates it, are constantly letting them to increase their production to supply more and more and more of this into our communities. I think we should somehow hold them accountable by charging them a fee for every pill that gets dispensed and then use that money directly for treatment. I think another way we could get around being so dependent on this is to maybe not prescribe one of these products for pain until you first tried an alternative. First aspirin, then maybe Tylenol or codeine. Then if that doesn't work, Oxycontin or Oxycodone. But not just to walk in and be able to say, my shoulder hurts, hey, here you go, here's the prescription for Oxycodone, have a nice day, and then that person is becoming addicted to this. It's a horrible shame, I think, what's happening, and I hope that we can honestly come back next year, look at this, find other ways of stopping the madness of the pharmaceutical companies making all this money on the pain and suffering of members of our community and the tragedy that many of us are living with from its results. Thank you.
Mr. Dendecker in the affirmative. Ms. Richardson.